An update on a local health concern. We've learned 2 people have died from the tuberculosis outbreak in Wyandotte and Johnson counties.
The Kansas Department of Health and Environment says the deaths occurred in 2024, but did not provide specifics. KSHB 41 investigative reporter Jessica McMaster digs into what the agency is doing.
It's the largest outbreak of tuberculosis since the CDC began tracking the illness in the 50s. 67 active cases, 60 of those in Wyandotte County, 7 in Johnson County. In a Monday email to the KSHB 41I team, Kansas Department of Health and Environment reports 2 people have died as part of the outbreak. The agency did not provide specific details surrounding those deaths, only saying both occurred in 2024.
Certainly, it can be a scare for the community and people living in that community.
We've asked KDHE for an interview 3 times since Monday. That request has gone ignored. However, Dr. Dana Hawkinson, Director of Infection Control and Prevention at University of Kansas Health System, says tuberculosis is airborne, meaning if an infected person coughs, sneezes, or sings, you could contract the illness.
The most common symptoms that we ask for and we look for are things like persistent cough, bloody cough, or what's called hemoptysis, night sweats, and weight loss.
Dr. Hawkinson says tuberculosis is not easy to contract as compared to other contagious illnesses like COVID, but that it's also harder to treat, that multiple rounds of antibiotics are often needed for 6 months or longer.
90% or more of those people never ever develop disease. You certainly run a risk of developing disease, especially within the first couple of years after being infected, but most people never do.
According to the email sent to our investigative team by KDHE, the agency is working with and following the guidance of the CDC. The agency says it's assumed responsibility for the coordination and distribution of testing, treatment, and medical consultation in Wyandotte County. For the I-Team, I'm Jessica McMaster, KSHB 41 News.